Preemption is another issue that we want to watch very closely. It deals with liability and lawsuits, for lack of a better term. At issue here is the federal agency or the federal, for example, the Food and Drug Administration sets guidelines for our products and how they should be used. If a doctor follows those guidelines at the state level and a patient has specific reactions, should they be able to sue at the state level, even though the doctor followed the federal guidelines? We certainly want to monitor that very closely. The medical device folks have similar concerns. These are provisions that we want to watch in the healthcare reform debate as well. Health information technology, you've heard a lot about that. How your medical records are stored, how they're transferred. When a doctor writes a script, should he be able, rather than writing an old-fashioned script, should he be able to email some sort of a document to the pharmacy? Should your medical records be stored somewhere? There's a lot of talk and a lot of hype around the cost savings that are associated with that $50 billion over 5 years. Part of that was the stimulus bill. Rep. Pete Stark of California wants to boost payments for providers using information technology and actually penalize non-adopted providers after several years. This is something that needs to be watched closely. There's certainly a lot of hubbub around it, but specifically how we make that work, there are challenges to be addressed. Medicare reform, something a lot of folks are familiar with. The Medicare Prescription Drug Act was passed in 2001. It's highly successful, highly popular. It's coming under cost. It's a good example of a public-private partnership. They do want to address the Medicare portion on the physician payment rates, the rebates for dual eligibles, which are people that are Medicare and Medicaid eligible. And then finally, the price negotiations, allowing the government to negotiate with individual companies on the price of prescription medications. Following biologics, I don't want to get too down in the weeds on it. It's a very interesting issue. A lot of our products are made, they're called biologic products. They're not made in the traditional test tube with elements and pounded together. They're grown sort of in a laboratory, and they're unique organic products. There's no protection for the data exclusivity around the research and development for these. There's a tremendous battle in Congress currently to pass a specific amount of data exclusivity time or a patent protection clause. That'll be something that's looped into the healthcare reform debate. On the partnership to fight chronic disease, I talked about chronic disease and the cost. This is an organization that focuses on healthcare reform and how it affects Americans in the sense of chronic disease. Instead of taking your medications, eating right, exercising, going to the emergency room and being treated by a physician if you don't have insurance. How can we flip that? How can we change that? How can we help folks manage their chronic disease and prevent chronic disease in the long run? Some of the members are National Association of Manufacturers, National Medical Association, PhRMA, as I mentioned, SCIU, Cleveland Clinic. A lot of groups. We have two co-chairs that are very prominent. Richard Carmona, who's the former U.S. Surgeon General, and Ken Thorpe, who's the professor and chair of the Rollins School of Public Health at Emory University. They've held a lot of forums, they've done advertising. They've really raised the level of conversation around chronic disease to a new high. And finally, as I mentioned in my opening remarks, the Platform for Healthy America that PhRMA released last year supports the following approaches to help strengthen the U.S. healthcare system, covering the 12 million uninsured Americans eligible but not enrolled in Medicaid and state children's health insurance program, SCHIP, encouraging coverage for the 5 million uninsured Americans already eligible but not enrolled in employer and sponsored coverage, improving the safety net of public health insurance programs like Medicaid and SCHIP, promoting benefits that meet the patient's needs, including generic and brand prescription drug coverage, and pursuing consumer choice and enhancing competition through the new pooling arrangements and insurance reforms. Anyway, yes, sir.
I have two questions.
Yes, sir.
Being a dairy farmer, why was I only allowed to take 15% of my income or 50% off for my hospitalization. Industry and business took 100% off. And second one, why every time when I go to buy a medicine, it goes up. I don't see anything on there about that medicine. Why didn't our cap or something large?
Well,
we want to help.
We do want to help, and that's a good question. The business and industry versus the individual, I can't answer that question. You're going to have to ask your congressman about that. That's a good question. Secondly, as far as the cost of medicines, that's certainly at the forefront of a lot of people's mind. The cost of our medicines went up less than 1% last year. The research and development that we put into developing these medicines, I don't know if you're taking brand names or generics or a combination of the two.
What do you get the 1% at?
What do I get?
$5 or $10 every couple of months it goes up. I don't say 1%. You give me a paper, I'll take it to my drug and say, only 1%. And you say it went up $5, $3, $5.
Well, that could be your copay that's going up as well, not just the cost of the medication. Certainly I can't speak to the specific drugs that you're on. I'm gonna Jenny, I've got Jenny who's from our federal shop. Do you want to address that question, Jenny?
One thing that we're actually working on and working really closely with the Senate side is on out-of-pocket caps, because right now I think when you ask people what their day-to-day costs, what's the most expensive thing you pay for in healthcare, people think medications, because that's what when you go to the doctor's office or when you go to the pharmacy, you pay out-of-pocket caps. We think that, or you pay the out-of-pocket copay, we think that there's no reason that drugs and medications should not be included in the caps that you'd have under your health insurance plan. Right now, you just, the hospital stays and about basically everything else in healthcare goes towards those caps, except for your medication copays. So that's one thing that we are pushing as part of new benefit designs, and that we would like to see is, it's not fair for patients for that not to be included. So that is one thing that we would like to see.
You Medicare Part D? Is the cost that you're paying now less than the cost that you're paying before, or Medicare Part D came along, or?
No, as you get older, you get more.
It's a good question, though. Yes, sir.
The question I have is, I go to my local drugstore to get my prescriptions. They only give me 30 days. But these drug companies say, oh, you can, through the mail, get them for 90 days with a big discount. Why can't we get that same discount from my local druggist? I can talk to him and ask him questions about my drugs differential. Talk to a phone, and they give you some recording, you don't understand what they're talking about. And I'd like to talk to but we're saving over pretty close $2,000, the two of us, by going through this, and I'm not sure we're going to stay on it yet, we just went on it. But I can't see why that same savings can't come to the local drugstore.
Well, I mean,
And that should be part of this reform business.
Right. Well, that's one of the things that I meant to say in closing was, you're in this day and age that your opinions and your voices are certainly listened to by this administration and Congress, and you need to be vocal proponents of what you think needs to be addressed. Now, certainly the relationship between our companies and the pharmacists or the pharmacy companies is certainly something that we could talk about, but I don't know specifically which plan you're talking about, if it's with an individual company or if it's with a pharmaceutical benefits manager.
Through our Part D, we have Medicare and Medicaid.
Now, I know that Congress is very open to looking at making Part D work better. There's certainly, it's popular, but there, as Jenny mentioned, the copay challenge, and as Clyde expressed, we want to hear ideas about how to make it work better, how to make it more affordable. So I would, now is the time, whether it's through Leroy or whether it's through your regional folks, to let them know, what you find challenging about Part D. Certainly, we think its core and the spirit of it has been very successful, given the enrollment numbers and the satisfaction levels. But certainly, there's better ways to make it more effective.